Thank you, Dr. Ball. That was very educational, and I think it really sets the tone for what we want to depict today here. We're about to get started, and I think it's a good time to actually give some thanks to the Charleston County Medical Society, Dr. Steve Shables, our current president, and Kay Wallen, who has been, Kay's busy talking, but Kay Wallen, who has been the executive director since she was about 30, which has been about 10 years, right, Kay? And Margaret Mays, who is going to be assuming the role of Kay Wallen with the Medical Society. And I'd like to thank the nurses and the group from MUSC that's come to help us out today, and all the medical students and the other staff, and the children and college students and the makeup artists. We're about to get started, so please encourage people to come down and see what we're doing here. Hopefully it'll be a very educational event for you. There will be a chance to ask some questions after the vignettes, after each of the vignettes run. So I'm going to turn the microphone over right now to Christy Conway, who's going to be our moderator for today. So part of addressing medical issues in a disaster, such as a hurricane or an earthquake or a tornado, power outage, a disaster could also include computer and audiovisual problems, which is what we're experiencing at this very moment. What we had for you was an audio lead-in with a hurricane. The good thing is it would have been coming over the microphone and over the speakers, not outside. But if you're paying attention to the news, you know that there's an active storm in the Gulf, in the Caribbean right now. And that's something that we face all year, or all fall pretty much. And other issues like tornadoes and water spouts. Just yesterday we heard about that. So just imagine a hurricane, and imagine the storm and the thunder and the lightning and the alarms and the transformers popping and the power going out. And that's the environment we're in right now. And as you see, we've got some victims here. We're going to start with our first vignette. So our first vignette, we have a victim who was outside after a storm. So the storm is cleared, and she's gone to do some cleanup work, do some yard work, try to assess what the damage was, and she didn't plan ahead. So she's gotten exposed to the sun, she's dehydrated because the water supply is not good right now. And so now you see Susie Lahr, one of our nurses, addressing her care in a makeshift cot that you might find perhaps in a Western shelter, like right down the way. And so she's getting attention here for her heat illness. And I'm going to turn it over to Christy to talk to Dr. Peter Carrick from MUSC Family Medicine, who's going to be attending to our victim.
Thank you. Okay, Dr. Carrick, so you're going to tell me a little about what's going on here. She looks like she has a sunburn. I've had that. What sort of problems else does she have?
So she comes in fairly sunburned throughout most of the sun-exposed areas of her body. In addition, while she was out there working, she didn't have any drinkable water. And so as she was working out there for 3 to 4 hours, she was sweating, losing a lot of moisture through her skin and also through her breathing. So not only is she sunburned, but now she's dehydrated, experiencing probably mild to moderate heat exhaustion, and always the concern is about heat stroke setting in.
Now, what should someone know about a heat index when dealing with yard work and things like that?
So the heat index is important, especially in the environment, because it calculates basically your heat exposure based upon the outside temperature, but also the humidity in the air. There's a certain point, your body's really dependent upon perspiration, especially in Charleston, to dissipate heat. And if it's a high heat index, meaning the temperature's high and there's a lot of moisture in the air, you just can't evaporate the water off your skin. And if you can't evaporate the water off your skin, you can't lose heat, and then you just accumulate it and suffer the heat illnesses that she's experiencing.
So what are the risks of sun exposure beyond obviously a really nasty burn?
So really the big thing about sun exposures are the burns, and really sunburn is a first-degree burn throughout most of your body. And the problem with that is it opens up your skin for more dehydration. You lose fluid through that skin because it's more porous. And so you lose a lot of the water that you normally don't think you would lose. You're going to lose it from the sunburn.
So how much water should she have had outside in the hot sun in a generally hot day?
So most times when you're preparing for a disaster, you plan on at least having a gallon of fresh water, not only for drinking, but for personal use, for every day of the disaster. So most people, you plan for, at the minimum, 3 days, at the most maybe 2 weeks. When it comes to kind of measuring how much you lose, and well, here's the other hurricane coming through. How much you plan is, while you're working out in the hot sun, if you have access to a scale, if you lose a pound of weight each day, you probably lost about a pint of water, and you have to replace yourself with that. So every pound you lose, it's a pint of water.
And now, would you suggest a gallon of water per day for both children and the elderly?
Children, elderly, and your favorite pet. Your unfavorite pet, I don't know what you do with, but for your favorite pet, you make sure you have a gallon of water a day. And then if she's going to work outside more, of course she's going to need more than that just to stay hydrated.
This is not an actual emergency. This is only a simulation.
This is a simulation, by the way. So how long can a person go without water then?
This is an ABC News 4.
So they're usually, what they talk about, the rule of threes, is you can go 3 minutes without oxygen, 3 hours without shelter in inclement weather, 3 days without water, and 3 weeks without food. For the water part, if you're working outside and you're losing a lot of moisture because of sweat and other factors, it's probably going to be a little bit less than 3 days. But if you're able to control your activity and all that, some people actually can last up to 6 to 7 days.
Okay, well, I had never heard that, so that's good information. Now, why should people be concerned when someone who's had heat exposure, when they're not sweating, but they're lethargic and they're confused?
So the big problem with mild to moderate heat exhaustion is going into heat stroke. And heat stroke can be a central nervous system catastrophe for individuals and cause permanent damage for the rest of their life, if not death. And the way you know kind of the difference between is it just really bad heat exhaustion or am I getting into heat stroke, one is you have high temperatures, but you can't always measure your temperature. Next is a lot of people experiencing heat stroke stop sweating. They don't have any more response to sweat, so that just allows their temperature to go up even greater. But probably most importantly, and probably the best indicator for heat stroke, is their mentation, their orientation. They become disoriented. They don't know what they're doing. They can't answer questions correctly. They become nauseated. They have severe headaches, but they're just not thinking clearly anymore. And that's usually the best sign that they're at least pending heat stroke.
So what can be done in advance of a storm to prevent all of these reactions?
So in this example here, always try to stay as hydrated as you should every day. Make sure you have enough water to stay around, especially if you're going to be active after. Make sure you wear sunscreen. And especially in Charleston in August, you probably should avoid working outside in the heat in the most sun-exposed part of the day. And most people say that's between 1 and 3 in the afternoons, but in Charleston it's probably best to work early morning or late afternoon, especially away from the sun.
So what is cellulitis and how might a disaster victim develop this condition?
So cellulitis is really, simply put, is an infection in the skin. The trademarks are pain, tenderness, redness, either a hard part or some drainage from a skin. And it's usually associated, especially post-hurricane, from some sort of wound or accidents that you've had. And so when you do get a wound while you're outside with your chainsaw or cleaning up after a disaster, for wounds, try to wash them off best you can, especially for puncture wounds. One of the best things you can do is using clean water, try to flush it out as much as you can, and then keep the area bandaged and dry. Don't let it be submerged in water, and don't let it get more dirt inside of it.
Why is that? Why can't it get wet or moist?
Just encourages more bacteria to grow inside. It just makes it a more fertile environment for bacteria inside your skin.
Okay, great. Well, thank you so much for answering my questions.
Thank you.
And thank you.
Another group of victims here, and these guys, not necessarily right immediately after the storm, but in the days after, they got into some of the bad water that Dr. Carrick talked about, and they got into some bad food because their refrigerator power was out, and they didn't think about the sandwich that they were eating afterwards. And so we've got Dr. Kent Stock one of our local infectious disease experts, here to talk about gastrointestinal illness after hurricanes and other disaster situations.
Okay, so in this scenario, what should this person have done to avoid this contaminated food or water?
Well, I think it's a very appropriate scenario, especially when you think about what happened in Haiti over a year ago, where you had a natural disaster occur and an influx of aid workers to try and help people that were obviously in great need. One of the byproducts of the Haiti natural disaster was an outbreak of cholera. And this is a prime example of this vignette where you have a disaster scene, and as a byproduct of that tragedy, you now all of a sudden develop a new obstacle to getting people better. So in this particular situation where you have a couple of individuals that have developed a gastrointestinal illness, which is probably precipitated by contaminated food or water, the first question is, as a basic necessity of life, what water can you access and use for your own needs? The general rule of thumb is, we tell all our travelers, if it's bottled or boiled water, it's safe. Many of you may be aware of the fact that for travelers, some of the local stores offer iodine tablets to put in the water, which may neutralize any organisms. They are actually helpful, but we don't advocate that for the natural setting. So in this particular situation, for individuals that may be located in a natural disaster scene, you really are looking at accessing water and trying in some shape or form to boil it before you use it for your own needs.
And as far as hand hygiene, why is that so important, especially after a disaster?
It's critically important because most of the bacteria that are being transmitted from person to person, the vehicle for that transmission is your hands. And so simple cleansing with soap and water can be a valuable adjunct to interrupt that transmission from person to person.
So in this scenario, why do you think that the food and water supply was contaminated?
Well, essentially, when you look at the Haiti outbreak, what happened is, particularly with cholera, it's contaminated food and water that occurs from human feces that actually gets into the water or food systems. A couple years ago, there was an outbreak of hepatitis A at one of the Ryan steakhouses because an infected worker was basically managing a salad bar, and as a result, people came by to eat the salad, and about 32 individuals contracted hepatitis A here in our own Mount Pleasant. So another example of how you don't need a natural disaster to necessarily place you at risk for a foodborne illness.
Well, that is truly disgusting, but it does illuminate the fact that this doesn't just happen in Haiti, but here in America as well. Thank you so much.
We're moving on to the third vignette, which I think might be self-explanatory for any do-it-yourselfers and gardening enthusiasts. Here we have Chris, one of our med students, who's going out after the hurricane with a chainsaw to trim down this branch that had fallen, and you know, he's got to be cautious because there's a number of hazards that he might encounter: down power lines, the climbing on the ladder, the saw itself, sun exposure. So he's doing a couple of things right. So now he's fallen. We'll get back to that in a second.
All right, tell me a little bit about this scenario here.
So as I was saying, you know, Chris was doing a few things right. He's got some sunscreen on. You can see that over here. He's got some bug spray while he's outside. He's well hydrated. He's taken heed to all the information that we've already just learned. You notice he's got goggles on while he's working. He's got a hat on, and he's wearing some work gloves, and he has some ear protection so he doesn't injure his hearing with the saw. What he did wrong is that he was over here sort of by himself. There was nobody with him. You notice there's some power cords, there's some water over here. The ladder, it looks awfully rickety. That's actually my ladder, and I'm probably going to get rid of it if anybody wants to help me with that. So he didn't have somebody helping him. He didn't have somebody paying attention to what he's doing. He had a branch come down because he wasn't really planning what was going to happen when this thing got cut, and he fell. And so here we have an injury. He's got some bumps and bruises and scrapes just from doing work, but as you can see, his arm is injured. And so Chris, I've already examined him, and his neck and his head are okay. He's alert and oriented. He did not hit his head. He has an arm injury, so I'm going to demonstrate putting a cravat, a makeshift sling on his arm, which is something that can be done to help tend to a disaster victim using items you might find around your home, including a tablecloth or a towel or something like that. So,
now I see a pretty nasty gash there. Perhaps he should have been wearing long sleeves.
I think that would have been a good idea as well. He got caught on the way down, but certainly wearing arm protection and the goggles and the hat and all the other things are very important.
Now, when I was watching that vignette, I thought he's going to fall and that chainsaw is going to cut his head off, but unfortunately we didn't have that kind of paint and makeup.
I couldn't recruit a neurosurgeon to the thing today, so I have some dressings that we're going to put on Chris here. It's a little bit of a challenge in the wind, and that's very much what it's like in an austere medical environment. So I'm just going to put a clean dressing on there. In an austere environment, taking care of injured people, you don't have good lighting necessarily, you don't have a good table, you don't have all the instruments or the essentials you need, but you can make do and at least provide some measure of first aid. People like Chris, as Dr. Ball said earlier, would tend to be ambulatory, and they might actually get themselves into an ER in a private vehicle, and so that tends to be how they might present.
So you did say use a clean dressing. Can you explain exactly what that means?
So at any drugstore, you can usually get a first aid kit. You can find them online, and really what you want to do is have sterile gauze and some sort of sterile gauze wrap. And so that allows you to cover the wound and prevent additional contamination. It stabilizes the wound. It can help control bleeding. And what I've done here for Chris, after I've gotten the dressing on there, I've placed a cravat. And what that is basically is a triangular bandage. As you can see here, the wind might take it away a little bit. And that triangular bandage is about 4 feet wide. And I've wrapped it around his arm so that one end of it goes up and around his neck, and the other one comes down behind his arm, and they actually tie together on the other side of his neck. So that's basically a sling, like you might get at a physician's office for an injured extremity, but it's a simple way to treat a problem very, very easily.
And that elevates the wound, so less bleeding, I'm assuming?
It can help stabilize it. It's also for comfort. He's going to be uncomfortable with that large gash in his arm. We don't know yet whether there's a broken bone because he did fall, so we have to consider that as well.
Now you mentioned that he's ambulatory, and that just means that he's able to move about. Now I noticed with the other patients that some had a red tag and some had a yellow tag. Now how would you tag this man?
Right. What about the audience? How would you tag our victim here? He has an arm injury, he's awake, he does not have a head injury, he can walk. Anybody want to give a response? Yell it out. So he would be green, he'd be ambulatory, he would be able to get to the emergency department on his own to receive care.
And why exactly do you tag victims in a triage situation? That's hard to say.
Well, it's a mouthful. The thing is, Christy, in a individual scenario like this, there's one victim, and I happen to be here rendering care in this vignette. In a mass casualty situation, you have limited resources. So if a calamity were to befall our community, just like Dr. Stock mentioned with Haiti or Katrina or the tornadoes in Missouri a year or two ago, you have limited resources to manage the care for a large number of people in the population who come in with all kinds of problems. And so the goal is to do the most good for the most people, bottom line. And that's the crisis standard of care that Dr. Ball spoke of. In his case, with the green flag, if it were a mass casualty situation, we would want to not spend a lot of time with our personnel resources and our supply resources on him. We do quick first aid, and we get him to another level of care that's necessary. but we might have somebody who has a critical illness or critical injury that needs to be tended to more urgently and take priority. And that's how the flag system allows us to accomplish that and communicate to one another.
Wonderful. Well, thank you so much. And everyone stick around. We've got the earthquake scenario happening here shortly.